Welcome back to Beautifully Broken with Patricia. I'm Patricia. Today I wanted to talk to you about Tarlov Cyst Disease. And the reason why I wanted to talk about Tarlov Cyst Disease is because this was one of my first diagnoses that I got prior to being diagnosed with Ehlers Danlos Syndrome. And I feel like it's important to discuss because not only is it another rare disease, but it's also very unrecognizable from the medical professionals. And I went down a path of being defeated before knowing what all of this chronic pain was, what chronic illness was, and to share this with all of you can maybe help you in your journey if that's where you're at. So what are Tarlov cysts? If you know, raise your hand. Of course, you can't see me if you're listening on the podcast, but if you're seeing me here on the YouTube video, you could see me. Raise your hand. Do you know what Tarlov cysts are? You probably don't. So I printed off a page from the Tarlov Cyst Foundation website because I wanted to make sure that I get the description correct for you for what the Tarlov cysts are. But know that if this is something that you're struggling with, your symptoms could be different from my symptoms, and that doesn't make it right or wrong. It just means we're different, right? So Tarlov cysts are a fluid-filled sac that is attached to your nerve root on your spine. And typically they're located in your sacrum area, which is where mine is located. They can be throughout your spine though. I'm in Facebook groups where I've seen several people where they are located up and down their entire spine. And so the cause of Tarlov cysts is unknown. But there are several theories, including a tendency to develop a weakness in the covering of the brain and the spinal cord, or a weakness that is present at birth. And I'm reading this from here from the Tarlov Cyst Foundation, because again, I want to make sure that I get this correct for all of you. So back to the Tarlov cysts. Some who have Tarlov cysts have connective tissue disorder. Pausing here. Connective tissue disorder. We'll get into that further, I promise. There's a question regarding the incidence of both in some patients. There seems to be a significant incident of history of trauma related to the onset of the most severe symptoms associated with Tarlov cysts. I was in a car accident in 1989. So I believe for me, that's where my Tarlov cyst maybe woke up, right? There's a trauma. That's big trauma to your body. So it's possible that Tarlov cysts have been present or asymptomatic, which means that they don't cause pain for a number of years. And I believe that to be so for myself as well. And then again, it was triggered by that traumatic event, car accident or surgery even. And it can cause the cerebral fluid pressure to increase. And over time, they fill with the spinal fluid. Some of these incidents that Tarlov cyst patients have shared are automobile accidents, which is me, what I believe I went through, especially rear end collisions, which is what I have, childbirth, heavy lifting, falls, etc. It's also been noted that some patients have their Tarlov cysts have woken up after an epidural, and you're not supposed to have those if you have Tarlov cysts. And I can go into that in further detail once we start discussing Ehlers Danlos Syndrome. But I want to get back to what the Tarlov cysts are and their symptoms. So some of the symptoms that I have, and I had back then in 2018, 2019, was I first started getting low back pain and was diagnosed with sacroiliac joint dysfunction. And that's the joint near the pelvis area, which does cause back pain. And I don't doubt that I don't have pain in that area, but I don't believe that that is my root cause of my pain. Also, there's weakness and or cramping in legs and feet, which I also have. Abnormal sensation in your legs and feet, which means like there's creepy crawlies on your feet. Pain while sitting or standing for even short periods of time. Yes, my hand is massively raised for that. Pain when sneezing or coughing, and I can attest to that as well. Soreness, a feeling of pressure and tenderness over the sacrum and coccyx area, which I can attest to as well. I've been sitting on a coccyx cushion since 2003 when I started working a desk job, and noticed that I was having some pain in the tailbone area. And though at that time it relieved my pain then, I still sit on the cushion because it's better than not, but I don't get as much relief. So how are you diagnosed with the Tarlov Cyst Disease? So for me, it was at a doctor's appointment. I was going through getting several injections into my SI joint to help calm down the pain, to rule out other issues, and those injections caused my pain to become more severe instantaneously. My pain went from maybe a 5 to a 7 to well above a 10. And again, there's that pain scale that I talked about in my first episode. That's important for us people, because we're always, for people with chronic illness and chronic pain, because we're always asked, what is your pain on a scale from 1 to 10? So those injections increased my pain level drastically. And after having no success with those injections, I did ask my doctor to order a new MRI. I had never had an MRI done of my sacral area, which is the coccyx area of your tailbone. And as I had mentioned, I had not only the low back pain, but pain in that area as well. And because I was starting to get new symptoms, such as when I lean my head down or when I get out of the shower, I get like an electrical zapping that goes down my spine. And doing research, I found that I have Learmeet sign, which is a possible symptom of multiple sclerosis. So I started getting all of these symptoms, so I asked my doctor to please give me an MRI so we could see if there was anything abnormal in the lower portion below the lumbar MRI that I had done. And when the MRI came back, I was told that it looked fine. So I started reading through my report, the MRI report, because I couldn't believe that everything was fine with the way that I was feeling. There had to be something more. And when I was reading through the report, I was just going through each sentence line by line to determine, what it is they're first medically saying, and Googling the words to finding perineural cysts. And I Googled what that was, and up came Tarlov Cyst Disease. So I instantly Googled Tarlov Cyst Disease and was directed to the Tarlov Cyst Foundation, and which has a wealth of information. And I actually spoke to the admin of that site the following weekend and said, what can I do about this? I have never heard of this. I had contacted my primary. He has not heard of this. And the woman that runs the foundation site said that there are two main doctors in the United States that treat Tarlov Cyst Disease. One is in California and one is in Texas. Well, I'm in Minnesota, so that didn't help me much at all. But I was able to send off the images to both of those doctors and my MRI reports to both of those doctors, and did have a teleconference with each of them separately to determine, if it was in fact Tarlov cyst that was causing the pain that I am in. And the first doctor did say that I was a qualified patient for Tarlov Cyst Disease surgery. And the other doctor, because I had been to so many other physicians and they had diagnosed me with so many different things, scoliosis, degenerative disc disease, I have osteoarthritis, I have fibromyalgia, I have facet joint issues, I have, I can't even remember all of the other diagnoses that I was given. But nonetheless, because I was given all of those diagnoses, this doctor, the other surgeon, these were both neurosurgeons, recommended that I get a diagnostic root block to make sure that the Tarlov cysts are in fact the cause of my pain prior to getting surgery, because you don't want to just jump into a back surgery without knowing for sure if it's the cause, right? So I went through my process of trying to, so this doctor recommended I get a diagnostic nerve root block, like I said, and in a process of a year, I had seen 14 doctors, and not one of them would perform the diagnostic nerve block on me, because they said that Tarlov cysts are incidental findings on an MRI, and they do not cause pain. They're not symptomatic. Well, I'm here to tell you, my pain is real. Something is symptomatic in my body. And if you can't tell me what it is, and you're doing all of these injections into my body, which is making me worse, which leads me to believe that's not the cause of my problem, then tell me what is. And no one could. So after I reached out to the two doctors in California and Texas, I was advised to send my MRI and some paperwork over to a different doctor in California who would review my information, and he rules out other spinal issues and health issues. And so I contacted this doctor, and his team sent me a packet full of information that I read through and needed to fill out before I sent anything back to him. And in that packet was a page for Ehlers Danlos Syndrome. Now, at this time, I'm more focused on my Tarlov Cyst Disease than anything else, because I'm sure that is the cause of my pain. So I filled out all of the paperwork, including the paperwork for Ehlers Danlos Syndrome, and it did catch my eye a little bit, because everything on that list for Ehlers Danlos Syndrome I had. And that's also a connective tissue disorder. And so let me go back and read this to you one more time. Some who have Tarlov cysts have connective tissue disorders. Tarlov cysts have connective tissue disorders. Some, not all, some. So the sheet that I filled out for Ehlers Danlos is connective tissue disorder. That didn't trigger into me because, of course, I didn't have the sheet sitting in front of me at that moment in time. I was just more concerned about, how do I get fixed? Because I'm in pain and I need this to go away. Nothing is working. Physical therapy, nothing is working. So this doctor got back to me in about 3 months, and he ruled out other spinal issues and recommended that I be seen and tested for Ehlers Danlos. And I remember that moment when I read his email, and I thought, okay, so I do have the Tarlov Cyst Disease. We know that. I believe in my mind 100% that they are symptomatic. I ended up having 2, not just 1. And on top of that, now comes into play Ehlers Danlos Syndrome. And it's hard when you are trying to figure out what is going on with your body. It is hard when you are in pain and you don't know why, and you don't have an explanation as to why, and you can't find a provider that can help you find out why. Now, don't get me wrong, I have a fabulous primary care physician who has worked with me for several years, trying to help me get the help I need. He's an advocate for me. He may not be knowledgeable in either of these diagnoses that I've had, but he has worked very hard to help me, and that I am appreciative of. So back to the Tarlov Cyst and the Ehlers Danlos Syndrome. I now started focusing more on Ehlers Danlos. As I said, I wasn't able to find anybody to do the diagnostic nerve block. I felt like I had hit a wall. I felt like I knew in my mind and my body that this was a disease that I have not had. But now I need to proceed with finding a physician in Minnesota that can diagnose me or test me for Ehlers Danlos Syndrome. And that in itself was a massive struggle. I became very good at Googling about symptoms, about diagnoses, about all the things. I've had multiple sclerosis ruled out. I've had so many different things ruled out, which is hard when you are in chronic pain 24/7 and you don't know what to do. You don't have that help. So Tarlov Cyst Disease is an underlying factor from my Ehlers Danlos Syndrome. And I'm going to end here because I don't want to go into both diagnoses on one podcast. I want you to stay focused and keep your attention as best as I possibly can in a short period of time. And so what I want to say before I sign off today is, regardless of the fact of whether you have Tarlov Cyst Disease, Ehlers Danlos Syndrome, POTS, any type of chronic illness, fibromyalgia, rheumatoid arthritis, anything that causes your body pain on a daily basis, know that if you're struggling and people are telling you that it is not real and that it is all in your head, I am here as one person to believe you. I believe you so heartedly, and I can say that because I struggled with that and still struggle with that with some physicians and some people and friends and family in my life. And you are not alone, and you may feel that way, and Lord help me, I felt that way yesterday, and that's okay to feel that way. But also know that you have at least one person in your corner here that if you need to do research or, find a physician that can help you, I'm comments on YouTube here, or I'm not sure if you can leave comments on the podcast here. I think you can on Facebook, but reach out and I will do the best that I can to guide you and direct you to websites that will give you the information, because you're not alone. And in a lonely space where we are broken, you are still beautiful. So thank you today for logging on and listening. I hope you've learned something about Tarlov Cyst Disease and can pass that information on. But until next time, just remember, we are all beautifully broken, and I am here in it with you together. Have a great week.